It's wonderful to see sort of the Expo, and this is your third year. That's fantastic. And from small things, big things grow. So I can only see in the community more and more people becoming aware of the death cafes and the Dying to Know Expos. So it's certainly the feedback we're getting through our cancer unit. More and more people are aware. So that's wonderful. So, all right. So what's my role? What do I actually do? So the role of the cancer support nurse is many and varied. So we accept and support new referrals when people are diagnosed with cancer. That can come from many avenues. Most of it is from the GPs or the tertiary hospitals after people have gone up to Perth for investigation. So we offer psychosocial support. I make contact with you a variety of ways. We try to attend oncology clinic appointments whenever possible with you. I also work in our chemotherapy unit, so if I'm not at a clinic appointment with patients, I'm usually working in our chemotherapy unit. We put in referrals to allied health, dietitian, physio, and so on. And I facilitate the cancer support group once a month. We're hoping to start up again next month. We usually just do once a month throughout the year, and we have guest speakers come along, or it can be a social get-together. We even had some of the cancer support group meetings here in the meeting room over there, which patients have really enjoyed. Just getting together and knowing other people are going through a cancer journey can be invaluable. I advocate for patients, sometimes with the PATS office, sometimes with the tertiary hospital, and there's the endless paperwork. And I particularly like this caption where it says, "Do you remember when all we had to think about was the patients?" Quite often now there's a lot of paperwork involved with any healthcare, as you know. So, I'm sorry, this writing might be a little bit small. I'll read it out. So, local services, what do we offer in terms of cancer support? Chemotherapy treatment. Many of you may know or may not know, we have a chemotherapy unit at the hospital, so we can treat most cancers here locally. We do an oncology service. We coordinate appointments, and that can be via telehealth, phone consults or face-to-face consults. The diagnostic services available here at Esperance is things like X-rays, CTs, pathology and ultrasound. There are some things that we cannot offer, which are things like MRIs and PET scans. Those terms might be familiar to you, and you do need to travel for those. But we try and keep most of the diagnostic services what you need here. We link in with visiting services, such as the mobile osteoporosis van that comes down once or twice a year. And we do referrals to other health agencies. Cancer support group and the Look Good Feel Better annual workshop. Is anyone familiar with that or has attended that? No? Oh, thank you, Meg, in the back there. So that's a workshop that we run for cancer patients, particularly going through treatment, and it's learning about skin care and hair care while they're on a treatment regime. And I think we just did, last year was our 10th year. We run it usually in October or November, and it's always been quite well received. I know, Meg, you enjoyed it, yes? That's it. So we run one of those, and we do lots of education sessions. Last year we did an advanced healthcare planning workshop at our support group, and a variety of guest speakers. Whatever the group is interested in learning more about, we try to facilitate that. So sometimes we'll have the physio come and talk, sometimes we'll have the dietitian come and talk, and so on. So I don't work on my own. I work as part of a team, which I enjoy very much. We do meetings. We link in with Kalgoorlie a lot. We use telehealth a lot for those sorts of things. We work as a team with PATS. Cancer Council, you might be familiar with. We do a lot of linking in there for financial assistance, support and accommodation. Possibly most of you have heard of Crawford or Milroy Lodge. So we do a lot of linking in there. We liaise with external services specific to the cancer group, so the Leukaemia Foundation or the prostate. And I'm also the McGrath breast cancer nurse, so we link in with the McGrath Foundation as well. We advocate for patients to have services locally, whether that's dental or the visiting cardiologist might come down, and patients while they're on treatment might need to have these investigations. So we will link in and refer to try and get you to have as much as you can, as much as you need locally. And we link also in with palliative care services. Now, I did hope that my colleagues would be able to join me this morning, and I believe Simone has spoken. She's our social worker at previous expos, but she's unfortunately been away sick this week. So I'm hopeful that one of my other colleagues can join us, but we'll just wait and see. All right, so our passion is optimal care for country patients and ensuring local people can access the services they need closer to home. There's a commitment to improving outcomes for patients in country WA. Why should distance be a barrier to healthcare? And I think that's something that, you know, in these more rural and regional communities, that's a really valid question. Just because you live 800 kilometres away, why can't you access the same level of healthcare as you would if you lived in the metro area? One of the things that patients do say to me is when they're having treatment locally for cancer, they say, it's so good, we don't need to pay for parking at the local hospital. And I do particularly like that caption, and it says, he was only here as a visitor but collapsed when he saw the car park charges. I particularly like that, and that is, it's very interesting because I go up to PCH and now RPH for my son's appointments, and you never know how long the appointment's going to take, and so I can't imagine what that must be like for patients going through cancer treatments to go up and, you know, do I pay for 2 hours of parking or am I going to be there all day or possibly overnight? So it certainly does rack up. So we're a public hospital, so we're covered by Medicare. So that's quite a good thing. So public, if you have treatment or you go to a public hospital, tertiary hospital, they will automatically refer you back to us because we are a public hospital. If you go through the private sector for your cancer treatment, they won't necessarily refer you back because private doesn't always refer to public. Just something to be aware of. Which is great. These events are great to raise awareness of what's available locally. So if you do go down the private pathway, you can ask for your paperwork to be referred to us if you prefer to have treatment locally. We're very passionate about patients having less travel to and from the metro area. I think we've all sat in a car, have we not, for 8 hours. And it's pretty exhausting. So imagine if you're doing that while you're on treatment. It's just exhausting. So, and less travel within the metro area. So even though you might have to go to Perth for some things, you know, we try and line up appointments for you. I don't do miracles, but I certainly advocate for you. So instead of needing a scan on a Monday and then, you know, something else on the Friday and then something else the following Friday, rather than having to go up and back and up and back and up and back, we try to advocate for you to have everything in the same week so that you don't have to keep doing all that travel all the time. Preferably on the same day would be great. Patients can continue to work while on treatment, so there's no reason you can't work while you're on treatment. It just might have to be modified or lighter duties while you're having that treatment. So, you know, we're really encouraging of that and can advocate for you in terms of liaising with the oncologist and work for you. We are the same staff each time in our cancer unit, so that's really nice. And the feedback that we've had from patients is it's so nice to see the same people every time you come in for treatment or for appointments. And every time they phone the unit for whatever, they know that one of the 5 of us, and they know us all, so you know who you're speaking to. I think that's really nice, a really nice kind of community touch. And patients have also said to me they have a lot of anxiety about not knowing anyone in the big smoke. So sometimes you don't know anyone. Going to Perth, you don't have any family up there, you don't have any friends up there, you're feeling quite isolated. So this drives our passion for optimal care for our country patients. So the pathway for rural cancer patients, just a guide. Your GP will refer usually to a metro hospital for further investigations. You might have initial diagnosis, surgery, more pathology, a treatment plan might be formulated. Then you can be referred back to Esperance and the oncologist that visits here, and then the treatment plan's put in place. So, as I say, I'll make contact with you, put in referrals, attend clinics. I'm also part of your treatment team, and I'll support you as needed throughout and link in with the other services. So here, I just thought this might be of interest. As you can see there was, in 2017, there were over 13,000 cancer diagnoses in WA rather, and it's predicted in 2025 we're going to have 17,000 cancer diagnoses. That covers all cancers, that's not just one specific cancer. And as you can see, cancer deaths back in 2017 were over 4,000, and in 2025 it's going to be 5,000. Now that's not a massive jump, and that's thought to be because there's a lot of early screening programs in place. We've got the Breast Screen WA bus that comes down. There's the skin cancer bus. There's loads of things that now visit Esperance, which is fantastic. So can I encourage everyone, if you don't already access those, please consider encouraging yourself and family to go along to these, because if we don't use these services, we're going to lose these services. So early diagnosis leads to better outcomes. Sorry, I've probably put the writing a bit small, even for myself. So the commonly diagnosed cancers in Australia in 2023 was prostate, breast, melanoma of the skin, colorectal or bowel cancer, and lung cancer. So they're the five main cancers that are diagnosed here, in Australia, but certainly in Esperance as well. Now, I put this slide in because I thought it was quite interesting. One of the questions I've been asked while I've been in this role is, does Esperance have a higher rate of cancer? Every second person I know seems to have cancer. And I thought that's a really good question. What is the answer to that? So I went onto the Bureau of Statistics. This is freely available. You can do this yourself. And I thought, what are the numbers? So the most recent statistics are 2021, and the rate of cancer for Esperance was 3% rather, so 411 people. That's how they broke it down, and that's people in remission and on current treatment. And I thought, how does that compare with WA as a whole? So WA currently has a 2.7% rate of cancer. So I thought, we are a bit higher then. Not much, but a little bit higher. And then Australia-wide, it's 2.9% people are diagnosed with cancer. So I thought that was quite interesting. But can I also bring to your attention the other statistics as well? Things like arthritis, dementia, diabetes and heart disease. It's all very much dependent on the population cohort. So Esperance is considered, like a lot of people come down here to retire, so you have to sort of bear that in mind as well. So you could say, yes, but it does need to be taken with a grain of salt and put into the bigger picture as well. So history of the Esperance Cancer Services. Prior to 2008, country patients had to travel to Perth or Kalgoorlie for treatment. So it was decided that in 2008, a chemo unit needed to be set up so that we could treat some patients here so that they didn't need to keep travelling. So that was open at three days a week for treatments. In 2010, the CT scanner was built up at the hospital, and then the Cancer Council funded a cancer support nurse position, which was Ali. And then in 2013, a second oncology nurse trained in our chemo unit. And then in 2013, the McGrath funded a breast cancer nurse position, which was myself, and I also trained in chemotherapy. There was an increase in 2019 in oncology clinics. So our visiting oncologist increased, so they would come down for face-to-face clinics and then do follow-up with telehealth clinics. In 2020, our chemo unit expanded to 5 days a week for treatments. And in 2020, we also expanded a haematology service. And then palliative care and the palliative care social worker joined our team. 2020 was quite a big year. There was a lot of funding kind of available for all these things. And then in 2023, we started the infusion lounge for non-cancer treatments, because prior to that, everyone who was on an infusion would actually come to us, but simply we had more patients coming through with cancer, so we had to make arrangements for our non-cancer patients. So, and the caption says, "Nurse, with this chemo cocktail, get me some mixed nuts and pretzels." So it's not quite like that, but we do look after you while you're in the unit. So where are we today? We have 2 to 3 visiting oncologists, face-to-face and telehealth clinics. We have 2 treatment chairs, which look a bit like that, quite comfortable. We have 2 full-time staff, 2 part-time and 1 casual who work in chemo. We have a cancer support nurse and a McGrath breast care nurse, which is me, both of those at the moment, and ambulatory care support. We have palliative care team, allied health support, and you might have been aware that there was a media release last year that the McGrath Foundation and the government were teaming up to provide funding for specialist cancer nurses other than breast. You might have seen that on the news. That's going to be, so watch this space, that'll be the next 4 years or so. So increasing funding for cancer nurses. And all of us who work in the unit, we all have plans for cancer services expansion. We just got to get management on the same page. But we're all very keen for expansion because we can see the need. That's just some resources there. Do I have a look? Thank you. Does anybody have any questions or would like to comment?
I was just asking Jo about age. You know, like you've said that a lot of people come here to retire, so that puts our age group up.
Yes.
Not by much, is it?
No, not by much.
No.
But bear in mind this is a WA-wide initially and then Australia-wide, and it also includes a lot of places, say mining towns and things like that, which perhaps don't have the same cohort of people.
Okay.
Yeah.
So as far as people who are living with cancer, have you seen more younger people? That's what I'm trying to say. Is there more younger people being diagnosed with cancer, or is there an age group that you say like is the danger time?
I'm not sure there's a specific age group. Great question. We are seeing younger people diagnosed with different types of cancers. But then you have to think about, is that because there's more screening programs available and their cancers are getting caught earlier? I don't know. It's very interesting to see how all of this will go, but certainly we do have some younger patients currently receiving treatment for different cancers. Yeah.
Okay.
Yeah.
Scary, isn't it?
Yeah.
Anyone else got a question?
So Albany was very similar for these statistics as well. They've got quite a similar cohort population, so a lot of people do go to Albany to retire as well. So it was quite interesting, like just looking at all because they take everything on board. Like it was quite a comprehensive. It was the census that they did a few years ago, so they didn't break it down to what specific cancers were in each area. It was more just a general overview. So it's only, but like when you think about it, Western Australia is 2.7% and Esperance is 3%, but you need to take that as part of the bigger picture. We are also a coastal town, so we just need to be aware, like more people are outside in the sun, like there's a whole range of factors that they take into account, but this is what was available on the Bureau. So, yeah, so it does feel sometimes like, yeah, we do have every second person that, has cancer or has experienced cancer, or we know someone who's had cancer. Yeah, it does feel like that sometimes, but we're sort of on a par with other country towns with the same population.
Just a general comment, where you were talking about making appointments in Perth and trying to line them all up. Anyone else had the same issue with people in Perth do not know where Esperance is. And they'll say, can you just pop up and see us the day before and that sort of thing. And it's just... Yeah, I'm sure everyone's had the same thing, but you're making MRIs or anything, but people just don't know where we are.
No. That's right.
That's very true. And if I may add to that, we've also had the situation where patients have phoned us and said, I don't know what to do. The tertiary hospital has phoned me and it's, 4 o'clock on a Thursday afternoon and they want me to be there at 8 o'clock on Friday morning for an MRI. I'm like, well, that's clearly not going to happen. So let me negotiate for you. So, yeah, it's getting better, but it's still out there, I think, yeah.
Can any of them be treated surgically, or if there's any, apart from the usual ones we get on legs and body, does everybody have to go to Perth for that surgery?
Mostly, as a general rule, surgery is something that's done at the tertiary hospitals. Sometimes Albany will do the particular surgery. It really will depend on the situation. So generally most patients will go to Perth for further investigations, surgery, and then their follow-up pathology appointment, and then a treatment plan is decided from there, and then they will be referred back to us from there. Yeah. That's a great question. I know that there's education that goes on for GPs as well as other health professionals in regards to cancer. So I'd like to think that yes, knowledge is improving and increasing all the time. So I would like to think that the doctors would ask you those sorts of things. But perhaps the best answer would be advocate for yourself. Go in and say, I would like these checks. For my age, whatever that might be. Do I need a bowel screen? Do I need a mammogram? Do I, all those things. So it is a lot about self-care as well, and just talking to your GP about those things. So great question. Yeah, yep. So, may I just share a funny story? Sorry, have I got time? Yeah. So, as you know, the breast screen van comes down annually now to Esperance, and you'll see on most of the advertising material it's aged 50 to 74 is their target audience for mammograms. And at the time, this is a few years ago, at the time I was 40 and I thought, here I am preaching this to all my breast cancer patients, go and get a mammogram, rah-rah. And I thought, perhaps I should practice what I am preaching. So I thought, but I'm not 50. I just feel that's not right to wait to 50. So I've actually phoned Breast Screen and said, I'm not 50, but can I book in for a mammogram? And I explained the situation. They said, no, it's fine. If you're over 40, come on down. So I went, sure, right, great. So I made an appointment and I went down and I had the experience of a mammogram so that then I could truthfully say to other women what it was all about. And I'm really, really glad I did that, because now every 2 years I just automatically am on their system and I get a mammogram. So sometimes it's about advocating for yourself and just, those sorts of things. Yeah, so, yeah. And I think, I believe the bowel screening, don't you get a letter in the mail when you're 50 saying, congratulations, you're 50, here's your free bowel kit, whatever it is. So just use those services.
We should have got ads for that on television.
Yeah.
Excellent. Thanks, Jo.
All right, thank you.
Thank you, Jo.